sometimes the test is simple, which is not that simple. We're always going to have complications. But the answer sometimes proves to be very difficult, which means how many times we will do and we will have a situation where we have a patient with extreme amount of pain, and we see that this patient is grinding the teeth, is clenching the teeth, doesn't have an eye guard, and it has a pain when it's biting. When we do, as an endodontist, your endodontist has to do this pain, but when you bite, you jump on pain. And then it comes and says, well, I have a root canal 10 years ago, and now it's failing. Well, the root canal doesn't look bad, to be honest, and to be fair with endodontists, but the problem here was, number one, this grinding and clenching will destroy your mouth. So after I did diagnosis, endodontic diagnosis that we're gonna see later, and I checked with cold, hot, and the pain reflected in all the moments that it was pain when I was tapping, it was pain when I was palpating the patient, it was pain when it will be biting, it will jump. And it's so fascinating because I go from this tooth to the last tooth. I always do diagnosis by quadrant because that's what I learned. And that's how we know that the classification of the disease as an endodontist, we have to understand it. And at the end, everybody comes with their own classification. But nowadays, the American Association of Endo says either you need a root canal or not, or is alive or is dead. In the old times, endodontists have to learn all these parts, but I memorized it 13 years almost. I was teaching in Mexico City in my university endodontics. So, as a faculty, you learn. But you as a patient, how do you know what to do with that toothache that is killing you? When you have, I have a lot of pain with cold, hot, disappears right away. How do I know when I bite it has pain? When I'm laying down, the pain wake me up. That is a root canal. But if you have pain with cold, sweets, and the pain goes right away, run to your dentist and said, please take an x-ray, a bite wing, which is when you're biting, and periapical x-rays, which are these, because the diagnosis is very important. If you have a restoration that is deep, and later on you have pain with cold, wait 4 to 6 weeks, sometimes wait 2 months, until the nerve is repairing. Baby that tooth, treat it like a broken rib or broken knee, broken bone, because it needs to recover. Our body has an amazing amount of defense mechanism, but the inside, the nerve of our root, it's even more powerful on defending itself. It is being able to develop defenses against us, even if we do mistakes. As a dentist, our nerve, as long as it's far from the enemy, is gonna survive, trust me. On top of that, what are you gonna do? Floss very well at night and brush with the technique I was teaching in the 3rd episode or 2nd for kids, and the 3rd one I remember was for adults. And then we will see if the pain goes away. When we open the tooth that we find that is the problem and the pain is gonna go away, of course, that we're gonna be very happy. And I have one of my best friends interested of a Saturday calling me, I'm in a plane, she doesn't drink, I don't wanna take medicine, what I'm gonna do, my pain is horrible. It's in my back tooth, and she was insisting it was a molar, like this molar. She says, please don't do any more testing, and I said, I have to. So she removed the hand, and then she will take water with ice, and the pain will come down. So everything of this type of diagnosis, I learned from Dr. Daniel Silva Gerson. So it was typical. If the pain was saying, oh, I have pain with cold, hot, but it goes away and it starts getting worse, I told you wrong, because it could be a defective restoration and you don't need a root canal. And please tell the dentist, take an x-ray. I'm gonna send it to Dr. Yacaman, she's an endodontist. send it to me. You can send it via Instagram. I will take a look. I will talk to your dentist if I need to talk to, and I will try as much as I can to give you the time, because you have to understand that keeping even the nerve of our tooth, it's extremely important. So don't have a root canal if you are not having this type of symptoms. Remember, if the pain with cold is not lasting for a long time, it's not a root canal. If the pain doesn't wake you up at night, it's not a root canal. If you don't have to take pain medications for the type of pain that you're having, it's not a root canal. So what do I do with my tooth in pain? Your dentist is going to take an x-ray first your blood pressure, take your x-rays, and in the whole quadrant. Don't let only on this, because sometimes the pain can go from the lower and upper. We're going to have a topic on the future that is called refer pain, where the pain can refer pain to the heart, or the heart can refer pain to the teeth. And it's not a tooth problem, it's a heart problem. You're having a heart attack and you have to rush to the hospital. Or we have a patient with a big infection, like I'm going to show you, that is even worse. So now, let's concentrate in a person that is just a simple root canal because she's grinding and clenching and she's not wearing an eye guard. And something happened in this tooth that you're looking at it now, but the cold was relieving the pain. And I show her and I prove to her that with no need of having the cold, I find out the pain was coming from this tooth. She's very happy until today. Probably I have the case later. So I did this, imagine, it was 2001. We are in 2022. She still have my root canal. We are very close friends. So every week when we're having dinner, I always ask about my tooth. I hope I have later until today the x-ray. This kid was the most impressive thing for me. It was an 8-year-old kid that came to see me because they told that he has to take the tooth out, because they said it was full of decay with this x-ray. And when you look at this x-ray and you said full of decay and you had an abscess, I've been very careful and I told his mom, let me do the root canal. He's very young, and let's place, after that, let's have this buildup that has to be here, and then we put a composite restoration. And then we have to wait for a sky at that time to grow, and I asked them to put a crown. She didn't want to do it, but she was coming every year. I saw the kid 10 years later until now. Imagine, it's 2003. Now it's like 20 years ago, 19 years ago. And the kid is very happy with the same tooth, has a crown. It was never extracted. It was not a lost tooth. What was the only problem? The lack of time the person was given to do diagnosis. And the mother lives so grateful. This kid is really, is an adult now, very famous in the entertainment industry. But I'm very happy because I told you, for me, every patient is the same. And I saved that kid. So, and this is my friend when I did the root canal in 2001. I tell you that I have to show you, I have to add in this one, but I will show you here later a picture of her in the 2020 or 22, whatever I have now. And the other day, a dentist called me and he says, oh my God, I have so much pain that I don't know what to do. Do I really need a root canal? So the dentist sent it to me, and she was a 30-year-old girl with extreme amount of pain. When I took the x-rays, you see, this is the crown as I told you before, and this is the nerve, and here, inside the sinus almost, this patient has an abscess, and that abscess was killing the patient with pain. So what we did, we did an emergency treatment, we removed the nerve, and then we finished the root canal. And it was a very successful treatment. The patient is happy until today. So I have my protocol how I work. I have my protocol how I use technology, how I mix, but irrigation is the most important part in our treatments of endodontics. So if you're gonna have a root canal, it's because the decay was already on the nerve. We're gonna see some figures about that. But if the pain is extremely acute because you have an abscess, not because it's with cold, hot, that is not gonna give you pain. So when a patient comes to you, the moment that you know it's not with cold, which is the most important exam in endodontics, then you know it's about a dead tooth. But in this case, it was worse. It's about an infection. So you're going to see the roots of a patient, whether you have a root canal or not, like in this case. And now this is an abscess. And the minute that you open, I get so excited. Maybe this is crazy of me, but look at the amount of pus that start coming off the tooth, mixed with blood. And then I remove the silver cones that they were there. That's what we specialize for. And like Dr. Silva will say, after you have 20 years of endo, everything becomes a little more easier. So that's what I said, you have to be persistent because the brain works by repetition. And probably this is our last case that I can explain to you. Remember, if your pain is not with cold that lasts for a long time, it's not a root canal. If the pain doesn't wake you up at night, it's not a root canal. But if you have this amount of pain that you feel it's going to explode a tooth and then you feel a pimple, now you're going to need a root canal. So, but if it's a little carious, it's just a restoration. And it's magnificent now that we can do with magnification and the microscope. So always choose a dentist that is going to give you the time. Be very clear, write down your symptoms per day because that helps us a lot. Because sometimes I ask a patient, how's your pain? And many times, guess what? It's not a tooth problem. We're not going to do anything. It's just a matter of the patient tightening so much the teeth and grinding. It's so much stress that the muscles is another topic. I'm referring the pain of the teeth. So be careful. Watch out there. This means that maybe the patient only needs an eye guard. But of course, if you as a patient say you feel like a pimple, that's an abscess already. The endodontists have to put something to track where the infection is coming and then go ahead and do it. So situations like this, patients like this that I treated in '94 in Mexico City that are continuing with success, that are now I see when I go to Mexico and they said, oh my God, doctor, I have a root canal from you from so many years ago. That is extremely important. So I will advise to you that if you have any type of pain and it's a very small pain, don't hesitate, even if it's a little bit, or maybe it's no pain, always ask your dentist, can you take a look at all my x-rays? I want to know if I have decay. I want to know if I have caries. How deep is the caries? I want to know if I'm brushing my teeth correctly. That's what you have to go to your dentist and ask for. So when you have a pain and you can have a headache and it goes all over your brain, or it's in the lower and it goes on the back, be careful the infection is not so big that you can finish with an abscess like this. And if you don't listen, it goes to the space of the brain, you can end up with a septic shock. Thinking it's just a little pain or it's a lot of pain, you can take Dolac in our Latin places, que es Ketorolac or Supradol combined with Tylenol. But please try to go at least to a pharmacy, an emergency to get antibiotics, because it can get worse or it can get slow. It can be chronic and slowly becoming acute, or you never know. Then you're gonna lose your tooth because you're destroying a lot of bone by bacteria. No, save your teeth. How? Floss and brush very well. You can add your rinses, but the flossing and brushing, following my technique that I give in the third chapter, is very important. Either it's manually per quadrants or with the help of the ultrasound, like me when I'm lazy, use the soft brush. So if you have any concerns, subscribe to the channel, put a like to this episode, follow us on TikTok, Instagram, where usually I announce the episodes that we're gonna give. And any comment and questions that you have, send them by Instagram. I try to answer to you as much, or through YouTube. I will answer as quick as I can. Thank you, and I hope you have enjoyed this chapter.